I'm Haley. I'm going to be your nurse
Hi,
today.
nice to meet you.
What brings you into the hospital today?
Oh, I'm just here for my wellness exam.
Okay, can you tell me your name?
Kim Miller,
Okay, and your date of birth?
8/16/72.
Okay, and then you live, it looks like, in Fall Creek?
Yep.
Do you live alone?
Nope, with my husband
Okay, do you have
and
any?
our teenage son.
Oh, okay. Do you have any other children?
Yep, they're grown.
Awesome.
My oldest is a nurse and married, and my middle is out in Europe somewhere, and
Well, very
yeah, I'm having a
cool.
good time. Yep, and then one more, and then that's it.
Nice.
I'll be okay. I'll be okay.
Well, I'm sorry that you're feeling that way
That's okay.
about your children being gone.
Not looking forward to it. Let's put it that way.
I see.
Yeah.
So do you have any symptoms today?
I know. Feel good.
Feeling good?
Yeah.
Do you ever have any history of anxiety? I see in your chart that you take, it looks like alprazolam as needed.
Oh, yeah, this is needed.
Okay, and what dose do you take of that?
I think they're 0.5 milligram. Usually I take half of that, so like 0.25.
Oh, okay. And how often
I
do you
think
need
that's
that?
my dose. Oh, 0.25. Okay. I think I get the 0.5 milligram tablets and then I break them in half.
Oh, okay. How often do you take those?
I guess it depends on what's going on. Like in September when my son leaves for college, I'll probably be popping him like candy. I'm just kidding. I'm just kidding.
Well, if you had to guess, how many times a week?
Maybe 2 at the most.
2 at
in the
most?
morning. Sometimes I get up and kind of think about what I had going for the day, and it makes me nervous. And I know I probably shouldn't use them, and I probably shouldn't need it, but it does really help me just kind of give me a calm and like help me think more clearly.
Well, that's good. That makes sense. Okay. And then you take, it looks like fluoxetine or Prozac?
Yep, I mostly take that. I do have a history of depression, but mostly for the anxiety. It kind of helps keep the anxiety at bay.
Okay, and what dosage of that do you take?
I take, it's prescribed 40, it says. I take the 40. Some days, I forget and don't always take it. I forget. But
Okay.
For the most part, I take it every day.
That is a medication that builds up in your system, your serotonin levels, so you probably want to make sure that you're taking that one regularly.
Oh,
as prescribed.
I know that. I'm not always.
But we always forget, so.
Yeah.
Maybe
so,
having a pill container that you can.
I'm not old enough for that yet.
That's true. Only 47.
No, I'm not
only
doing that yet. No,
okay.
no pill container for me yet.
Okay.
But thank you. I appreciate the advice. I'll just get more organized.
Okay.
Because if I set them like in, if I my bathroom routine, sometimes I get out of routine, then I forget to take it.
Yes.
Yeah.
What kind of things make you anxious during your week?
I guess it depends on, like work, like what I got going on. If I feel like I'm getting behind at work or, because I'm an accountant and especially like busy season, like right now, tax season, like, oh boy,
Okay.
and I'm working more than, I normally do and, I gotta, get a lot done. So that causes me anxiety and then, I don't know, just kind of like, just having an underlying anxiety, like sometimes my thinking just gets kind of messed up and I don't even know why,
Well, that must be difficult for you.
Yeah. It's fine. I've been dealing with it most of my life. Like I was a teenager, and had it. Didn't realize I had it, until, I got diagnosed with it. And lots of people deal with it. There's worse things.
Good. Okay. Well, I'm glad that you're coping with it.
Oh, yeah.
Do you have any other coping mechanisms? Non-pharmacological coping mechanisms?
Oh, like you mean like alcohol?
Yoga.
Oh.
Reading.
So, okay. Yeah, I do like to read. I have tried yoga. I know it's kind of fruity for me. I do like to exercise. I, go to the gym like 4 times a week, and
very good.
Yeah, and I like to go to some dance classes. And I'm not good at it, but in my mind, I am.
Dance classes, okay. How long do you usually do that for?
30 to 45 minutes.
Okay.
Yeah, it depends on if I like the instructor or not.
Okay.
Or if it's a good video, or if nobody's watching, I might go longer.
At your age, do you do any weight training?
Oh yeah.
Okay, good. It's good to keep your bones
strong. I go to Strong Bones, this class.
Good. Okay.
I'm not an older adult yet, but it's in my community and it's free, and so sometimes if I'm not working, I'll drop in on that. But yeah,
very good. That's great.
Yeah.
Awesome. Good to see that you're keeping up on your health.
Yeah, thanks.
And then it looks like for other medications, I see you use an EpiPen. Can you tell me about your allergies?
I am allergic to penicillin, which I don't use the EpiPen for. I know that.
Okay.
So the EpiPen is for my peanut allergy. I've had a high peanut allergy. So.
What kind of reaction do you have to peanuts?
Oh, like bad. I forget the word. Like
Anaphylaxis?
Yeah.
Okay, so you use the EpiPen to treat the anaphylaxis.
Yeah.
Okay.
That's right.
Okay.
And I don't know why I'm laughing. This is kind of goofy. So I have to be careful.
Allergy.
Yeah, it's just why people are allergic to peanuts is kind of weird. But yeah, so yeah, I've had anaphylaxis for it before, and especially when I was younger, I didn't realize but now I know obviously no peanut butter and
So you know how to avoid it, obviously.
I read I read the ingredients, like especially if I'm buying I don't really eat cookies, but if I were to eat a processed cookie, I know that look for that sign, eggs and peanuts and milk and stuff.
Good. Okay. Good. Yeah. And then, do you have any other allergies?
Well, I suppose they say I'm allergic to latex. Like, bring a balloon anywhere near me.
Okay.
I'll just get itchy. That's all.
And you don't have to wear gloves at your job. Rubber gloves.
No,
latex.
it's still different than nursing. We're not, getting nasty, getting dirty or anything. Yeah.
Good. Okay.
Yeah, it's a pretty clean job. No gloves required for my pen and pencil and my keyboard.
What shift do you work at your job?
Day shift. But again, like this time of year, I can't even believe I'm able to get in, have time to get away because, we're working, 10, 12, sometimes 14-hour days.
That must be
to
busy.
get the taxes done. Yeah.
Yeah.
But it's okay. I chose it. It's good.
Okay.
I like it.
Well, good.
Still nerdy. But.
And let's move on to your vaccines. Do you know when you had your last tetanus shot?
Nope.
I'll look in your chart. It looks like you had your last one on 4/19/2015. Does that sound correct?
Oh, yeah. That sounds about right. Yeah.
And never got a pneumonia vaccine?
No, that's for old people, right?
Ages recommended 65 and up.
So
you've got 20 years about. So, yep.
Yeah. Although a lot of places diagnose geriatrics as 55, so I'm taking offense to that as I'm approaching,
You've got time.
Yeah.
And do you know when you had your last flu shot?
I'm pretty sure I got it last year. Yeah, they really encourage it, even though I'm an accountant at our workplace. So
flu has been pretty big this year.
Have it?
Yep. So good to stay up to
date. Do you get the flu shot?
I do for work, yes.
Do you have to?
Yep. Yep.
I suppose in healthcare they require it.
Yep.
Good, because I don't want you giving it to me.
I won't. And then let's just go over your other medications here and make sure we have them all. Can you tell me anything else that you take besides the EpiPen, Prozac, Xanax?
I've got high blood pressure, which I got diagnosed with last year. Something like there's an M.
Oh, metoprolol?
Metoprolol, yeah.
Okay. Yep.
Yeah.
Do you know the dose?
I don't know. It's like a white pill.
50 milligrams?
50, yeah, 50. Yeah, I try really hard to take that every day.
Okay,
I know that's even more important than the fluoxetine.
Yes.
So that one I tried really hard not to forget because my blood pressure got really high last year. So that was kind of a wake-up call.
Do you check your blood pressure at home?
No, I don't know how.
So once you leave today, part of your wellness exam, I'm going to encourage you to go to either Amazon or you could go to CVS and pick up your own blood pressure.
Oh, does insurance pay for that?
No, but they're about $10 to $15 for a...
Oh, I guess. With all the overtime I'm putting in, I probably
can
pay for that.
So just it's good to check it. Just to make sure that you're within normal limits. And
or I'm at Walmart, I could go get that free one.
Yeah, you can do that too.
And those really reliable?
They can be. Having a manual blood pressure is more accurate.
Well, I wouldn't know how to do a manual one.
Well, you could use the
one you talked about. Yeah. That's not manual, right? Like I don't have to listen to the stethoscope.
No.
Oh, gotcha.
No, you could just get a wrist one, which isn't as accurate, but just having some sort of an idea.
Gotcha.
We did check the blood pressure prior to the interview, and it was within normal limits.
Oh, good.
So your blood pressure so your blood pressure is normal. And then any other medications?
I take ibuprofen and Tylenol occasionally for low back pain, but I have that Nexplanon implant. Is that considered medication?
Yep. How long have you had that for?
I think I got it in a couple of years ago.
Okay, so you know to get a new one every 3 years?
Yeah. Well, I'm 47, so maybe I'll be in menopause before then.
Do you know when your last period was?
Like so often now. Like 2 weeks ago, maybe.
2 weeks ago. So you have pretty irregular bleeding with the Nexplanon?
No. I shouldn't be getting a period with that, should I?
Periods can be regular or irregular depending on the person that's using it.
Oh, okay.
So.
Yeah, no, I do get quite a bit of break through bleeding and stuff. So that's kind of annoying. So I may get that taken out. I don't know.
Yeah, you could get it taken out and try a different option that might be better for you.
Sure.
So birth control pills, the ring, the patch, the shots.
Or my husband could just go get a vasectomy.
Or he could get a vasectomy.
Yeah, if he would man up, right? Yeah, sorry. I get goofy sometimes, sorry. It's that way I deal with my anxiety.
Okay, yeah.
A little nervous. I giggle when I get nervous.
So next one on we have, it looks like you talked about the EpiPen, and that looks like it's the 0.3 milligram injection.
Sure.
Do you know the last time that you had to use that?
Maybe last week. I think I came home from work with a really bad headache and didn't want it to turn into the EpiPen. Oh, I'm sorry. I thought you were talking about the Imitrex.
Okay, so you take Imitrex.
I didn't say. Oh, you were talking about the EpiPen.
Yeah, that's okay. You know the
I
last
got
time you
confused.
needed the...
I got all flustered. Yeah,
that's
sorry.
okay.
Yeah.
So you said you had a migraine last week?
Yeah.
Okay.
Yeah, after a long shift at work, and it, just started with the aura, and I didn't want it to turn into so I know to give it to myself when it starts, because then it works better.
Okay.
So then I can avoid the whole headache altogether.
Okay, good. And does that work pretty well for you then?
Yep, it's great. Yeah.
Okay.
Yep, I really like that.
How often do you get the migraines?
2, 3. I mean, it depends on what's going on, like stress, and what I'm doing. So a couple times a month, maybe.
Oh, okay.
Yeah,
Good.
it's pretty well managed. It used to be a lot worse, but
good.
Yeah.
And then we're just gonna go through your past history of your tests that you've had done.
Okay.
Do you know if you've had a mammogram before?
I had one not too long. Yeah, there are lots of them. I had one last year. I think.
Year?
Was it last year? What does it say?
It looks like November 2nd, 2018.
Oh yeah, just not that long ago.
Okay, and that was here at Mayo Clinic.
Mm-hmm.
Okay, and then
and it was good.
No colonoscopy yet?
No, I'm not that old yet.
Okay, so in 3 years you will be getting, or they recommended age 50, just so
it's gonna be a bad day.
Cancer prevention. So we want to make sure that everything's normal.
I hear the prep is worse than the colonoscopy itself.
It doesn't have too much of a flavor, but you do have to drink a lot of the Go Lightly. So.
Yeah, but I mean, and then
the cleaning
being up all night. Yeah, that's what everybody says that's worse. So.
Yeah, it can be kind of like pooping Mountain Dew is what they say.
Oh.
So yes.
Well, my husband turns 50 this year, so I'll have
You'll
fun
know,
watching
yeah.
him. Yeah. I'll make sure he uses the other bathroom.
Yeah.
To our bedroom.
And we did your cholesterol panel before you came in, and just so you know, that was normal.
Oh, good.
Do you have any history of high cholesterol?
No, my parents do, but they eat terrible. So I eat pretty good. I keep low fat, low carbs. I eat pretty healthy, so I would expect my cholesterol to be pretty good.
Good. Do you need any education today on your diet, or do you think you eat
I
pretty
think I
well?
eat pretty good. Yeah, I don't eat sweets. I stay away from carbs. So
good.
Yeah. I think my diet's pretty good. I'm sure there's always room for improvement, but.
Well, your BMI looks very good. So
thank you.
Any past history? Do you know when you had your last pap smear?
We don't have to do that today, do we?
No, not today.
Oh, okay.
Because you only need it every 3 years.
Oh, because it used to be every year for a long time.
Yeah. Now it's every 3. Cause,
okay.
Have you had any irregular ones in the past?
Oh gosh, yeah. A few years ago, I had one, and but then it turned out. It wasn't.
It looks like you've had no irregular ones in the past.
It must have been something else then. Okay.
It looks like they've all been normal, and you won't need one until 10/22 of 2021.
Oh, I remember that they weren't sure, and then it came back normal.
Oh,
that's
okay.
what it was.
Good.
Yeah.
And then you had your bone density done already, and that came back normal, so we don't need to talk about that. And it sounds like you're eating healthy.
And exercising, and I know that's important for bone health.
Yep, and you do the weight training, so.
Yep.
Now we're going to move on to the social history aspect of the interview.
No.
You said that you are sexually active, so with males or females?
Well, I have a husband, so
probably
just
male?
Just male.
Okay,
just one.
Just one, okay.
Yeah, just one. But thanks for asking.
How many children do you have?
3.
3? Any complications with those pregnancies?
No. Been a long time.
Any C-sections?
With my first.
With your first, okay. And then the other 2 were born vaginally?
Yep.
Okay. And then no complications with those?
Nope, all was good.
Okay. What about alcohol use? Can you tell me a little bit about that?
1 to 2 glasses of wine, in the evening.
Okay.
A few days a week. Yeah.
Okay.
Nothing excessive.
Okay.
Yeah.
What about smoking?
I knew you were going to ask me about that one. So I don't know why, being stupid, I decided to start smoking a few cigarettes a week at age 44. Go figure. You know, a midlife crisis, maybe thinking my kids are all leaving and hearing, you know, people smoke with anxiety, or maybe I thought it helped me lose weight. I don't know. So I don't smoke much.
Okay, how many cigarettes would you say a week if you had to guess?
A couple, like when I go to the bars. I don't know why I go to the bars at my age, but okay. I guess, you know, my friends call me up and it seems like a silly thing to do, but.
So just when you're drinking, you occasionally have a cigarette or two?
If I'm out with my friends, I guess, you know, if they are. I don't know, it doesn't taste good. I don't know why I do it. Like,
well, it is still, even though it might not seem like a lot to you and it might seem pretty harmless, just so you know, it is pretty easy to get addicted to the nicotine.
Okay.
And even a little bit of cigarette smoke increases your risk greatly for emphysema, which is a very, very bad lung condition.
What about that vaping thing or like that?
Do you vape?
No, but is that better?
No, most of those actually have more nicotine in them than cigarettes.
Because like the kids are all doing that these days.
The Juul pod.
Oh yeah, I heard about those.
Yep, those are not very good.
Yes, so cigarettes are better than those?
Well, neither is recommended.
Okay, gotcha. I'll try and cut it out this year. Maybe next time when I see it this time, I'll be done.
I'll send you home with a pamphlet on
smoking. I'm probably not addicted yet, right? It's just probably becoming a bad habit that I need to stop before it becomes a full-fledged addiction.
Yes, that's what I would recommend. Yep, and we'll send you home with some teaching on that today.
Okay, I don't need like the nicotine patch or anything, I don't think.
If you become addicted to it, then you might just, if you're having withdrawal symptoms, but it doesn't seem like 1 to 2 a week at this point is something that you would do.
Okay, I'll cut it out.
Okay, good. All right. Any drug use, illegal drug use, using other people's drugs?
Nope.
No needles?
Nope.
Okay.
Don't go near that stuff.
What about chewless tobacco, or smokeless tobacco? I mean, like chew or snuff?
Oh, that's nasty, no.
Okay, good.
That's not very womanlike.
And no pipes or cigars?
Oh, gosh, no.
Okay.
That's even less womanlike. Okay. I don't think my husband would like that very much.
Okay. And it looks like no history of asthma?
Nope.
No cancer?
Mm-mm. There's cancer in my family. But.
Okay, can you tell me who has had cancer in your family?
My dad. Is that right?
It looks like you're. It's page 5 or 4, I think.
Oh.
It's a table on the top.
Oh, my maternal grandmother, my paternal grandmother. Oh, both my grandmas.
Okay,
where did I get my dad from? I don't
know. What kind of cancer did they have?
Oh, like some type of melanoma or something, like a skin cancer.
A skin cancer,
yeah. One had skin cancer and the other one was like a lymphoma, I think.
Okay. Did your grandparents have any other diseases on your mom and dad's side? Both sides?
Well, I know I filled this out before. It's hard to remember. You talked which.
Yeah, it's kind of hard to remember these things without looking at the chart.
Yeah, you're asking me who had what?
Well, let's first talk about your mother. So your mother,
oh, okay.
She had any history of any of the listed diseases?
Well, she's also got the anxiety and depression that I get from, and high blood pressure. So I inherited both of those.
And your father?
Well, he eats terrible, so he's got diabetes and high cholesterol. And
okay. Is
hopefully
he still
I don't
alive?
Yep, and he still eats terrible, and so hopefully I don't inherit that stuff.
Yeah. Well, it sounds like you eat pretty healthy and exercise, and your cholesterol is normal. So.
Yeah. Okay.
And then your siblings?
Well, I have a brother that's been in and out of rehab for drug abuse over his lifetime, so he's been battling that.
That must be tough.
Yeah, it's hard to see, but you know.
Do you still speak with them?
Oh yeah.
Good.
Yeah, I know it's a disease, and you know, he's not alone in it.
Good. Yeah. And then what about your paternal grandmother and grandfather?
Well, so paternal grandmother, yes, she had that cancer, high blood pressure, but you know, you live long enough, who doesn't have high blood pressure, right?
Right.
Paternal grandfather, he did die early of a heart attack and a stroke.
Oh,
so
okay.
He had a stroke and then had a heart attack after that.
Oh. What
yeah.
age did he die at?
In his 50s.
That is very young. Okay. Well, thank you for that history.
Yeah.
So you have high blood pressure, and that seems to be well controlled with the metoprolol.
Yep, seems to be doing good.
Any other history besides the migraines and the high blood pressure that you can think of?
Oh, I don't think so. I think other than that, I think that's enough for now. Okay. I'm sure next time you're on ICU, there'll be something added to it.
That's how it goes.
Don't tell me that.
And for surgical history, you had the C-section. Have you had any other surgeries?
I had my tonsils out when I was 5.
Okay.
I had my appendix out when I was in high school, sometime like 16, 17 years old. I forget exactly. And then a couple of years ago, I got sick of the bump on my nose, and I finally got a rhinoplasty, got my nose fixed.
Oh, okay. Did that seem to improve your feeling about yourself?
Yeah. Yeah.
Good.
So I'm okay to look at my nose sideways now.
Good. Well, that's great. I'm glad to hear
Otherwise,
it.
I was looking at myself square on in the mirror. Yep.
Okay. Well, good.
Yep.
I'm glad that you found that could make you happy.
Yeah. It was good. Yep. It's all good.
And 3 births.
Mm-hmm.
Any other pregnancies in your history? No? Okay. And when was your last menstrual cycle? You said about 2 weeks ago?
Well, I mean, if you can count that, because I'm on the next
spotting.
one on. So, yeah. I mean, I would assume it would be like 2 weeks ago, but, it's hard to say.
Would you like to talk to the doctor today for a referral to your gynecologist about?
No, I'll think about it. I think I'll think about it.
Okay.
Yeah, I'm good for now. But
okay, well, I'll give you the number to call when you leave if you wanted to schedule something to fix that.
Okay, thanks.
And you said you're an accountant. Okay. Do you use marijuana at all?
No, but I might if it becomes legal.
Okay, then. Well, it's still not recommended.
Okay, I'm just kidding.
Okay.
Yeah. Not recommended, I know that.
Right.
Yeah, it's still a gateway.
And then it says for specialties, the only ones you see that I can see in your chart are cardiology and OBGYN.
Specialties meaning?
So as in like outside of internal medicine where you're being seen today.
Gotcha. Yep.
Okay. And then who do you
see? I need to see cardiology? I mean, I just have high blood pressure, and I think they sent me there and originally, because of, normal tends of like forever, and then, a year ago, all of a sudden I'm in the 220s.
Only if you are finding yourself having any symptoms related to your high blood pressure, or once you start checking it regularly, if you're noticing that your medication doesn't work. Otherwise, you can be seen in internal medicine.
So eventually, you guys can manage that.
Yeah,
okay.
Yeah. It was just for that. Who do you see in cardiology?
Dr. Casper.
It looks like you see Dr. Saperstein.
Oh, really?
Maybe you see Dr. Casper.
Maybe I saw him one time though.
Okay.
Oh, maybe it's just who I saw last. My regular is Dr. who?
Saperstein.
Oh, okay.
Okay, good. Okay. And have you ever been in the military?
No.
No. And have you traveled outside the United States in the last 30 days?
No.
Okay.
Mm-hmm. Would it matter?
Yes. Just because we might need to update some of your vaccines.
Oh, gotcha. I wish I'd been somewhere besides here. You've seen the snow out there? Of course you've seen the snow out there.
Yeah,
Here. Yeah.
Lots of snow.
Yeah.
And then we're just going to review your body systems. So, any difficulty seeing? Any blurry vision? Anything like that? What about hearing? Ringing in your ears? Any difficulty with sinus infections or runny noses? Sore throat? Headaches besides the migraines? Any problems completing activities at home? So climbing upstairs, doing errands? No? Okay. You're able to cook your food for yourself and
hope so.
Okay.
No one else is going to.
Okay.
If I don't cook, I got a husband and son starving.
Any difficulty breathing today?
No.
No cough?
No.
Okay. Can you tell me about when you do exercise, do you have any shortness of breath? Do you have anything like that?
No.
No? Okay. Any difficulty going to the bathroom?
No.
No? Do you know when your last bowel movement was?
I had a couple days ago maybe. It's kind of hit or miss.
Do you take anything to help you or eat anything different to help you?
No, I know I should probably increase my fiber. I started on some fiber gummies. That seems to be helping, but
good.
Yeah.
Yeah, every day is about normal, but if it's every couple of days, that's probably okay too, but we don't want it to go too long and have you have an obstruction.
Oh, okay. Yeah, it doesn't seem to be an issue.
No muscle weakness? No? Okay. Well, is there anything else that I can do for you today?
So you'll refill all my prescriptions then?
Yep, they'll just be sent over to the CVS on bracket.
Okay.
Your regular pharmacy.
I don't need a mammogram again, because I had that not too long ago.
Yep, I think that's every 5 years.
Oh, I thought it was every year after 40.
Oh. I think it's maybe it's every year.
Mammogram.
Okay.
Yeah. For anyone, that's what they recommend now.
Okay.
Maybe it's, who knows.
Well, good. You can keep up on that.
I'd rather it was every 5 years, but.
All right, and I'll send you home with that smoking cessation
Okay.
information, and then you're good to go.
Okay, well, thank you so much.
All right, thank you. Have a great day.
Nice to meet you. Okay, thank you.